Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And welcome to the Ask Dr. Pane segment, where he will take your cosmetic surgery questions and answer them live on the air. And Dr. Pane, this question here is kind of a general question, came on Facebook. They're interested in knowing, what does double board certification actually mean? And maybe you can explain that and talk about your background and history a little bit.
Sure. Basically, board certification, started 1930s. Passed after people completed a residency. They then went on and did voluntary testing to show that they had mastered a certain body of material in that field. Now, these days, most people are going to have that certification in their core specialty. But what we've seen with medicine and the changes in the healthcare sector and everything is that the practice of plastic surgery, which classically was reconstructing wounds and things like that, and it still is, and also some cosmetic surgery, has gone greatly into the cosmetic surgery direction. Also bringing in a lot of doctors that are from other fields that are, sometimes they're doing their core areas, the cosmetically applicable zones of it, and other times getting kind of far out of their field into different areas with varying degrees of success. This could be an entire topic on its own. What we try to do is, in my background, it started with general surgery, and I did a complete residency in that, and then I did a complete residency in plastic surgery. And even to this day, and going back to my entire time in residency, I was always interested in anything difficult, unusual, whatever. Even when I got into practice, I would assist doctors in different specialties. So we've got kind of a wide array of things that we can do. So people will seek me out for the normal things, and then also for things that might be a little unusual. They might have been turned down. They might have had surgery somewhere else, sometimes in different states, different countries, and things may not have turned out the way they want, and then they might come see us, and we'll see what we can do with them. So that's the basics. And so we have and maintained certifications in both surgery and plastic surgery. So it gives us kind of a wide array of things that we're able to do. And we do it very safely. I track anything that I can determine to be a complication, and I track it against published rates of these problems in the surgical literature. And for every single one, I can tell you that our rates of problems are about 9 times less than what you see published. So an example, there might be something where if it happens 15% of the time, we might have it happen 1% of the time. So that's about a 90% reduction in risk for these things. And it's true across the board, essentially, with every procedure that we do. So we tell people that we feel confident we can offer them a safe experience with a high chance of getting a satisfactory result. And if anything goes untoward, it's almost likely going to be something very minor in almost all those cases. So that's the basic overview of what we feel about credentials and certification in surgery and so forth.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our Facebook page, website, LinkedIn, or Twitter account. And Dr. Pane, we appreciate your time, and we'll see you on the next question.
Great.